insecurity, leading to, as we've talked about a bit in here, 1 in 7 families struggling to put food on the table. We are heartened by the sharp decline from the implementation of a lot of these funds, as you can see in this chart, in the number of American households that say they are behind on rent or did not have enough to eat in the past week. Obviously, there's a lot of work to go and a lot more to be done, but we can see a clear positive downward trend on this chart, which is quite encouraging. Finally, a quick preview of the week ahead. On Tuesday, the President will deliver remarks on the COVID-19 pandemic. As you all know, Wednesday, the President will address a joint session of Congress. Among other topics, as we talked about a bit yesterday, he will lay out the American Families Plan, the specific details, and discuss a number of other issues that are important and major priorities to him, including expanding access to health care and addressing, putting in place policing reforms. On Thursday, on the President's 100th day in office, he and the First Lady will travel to Georgia to highlight how he has delivered on his promises to the American people. While he is there, he will participate in a car rally. And on Friday, he will have additional out-of-town travel that we will hopefully have more details for you in the coming days. Finally, I know many of you saw this and reported it and tweeted it, but we announced this morning that the President will travel to the United Kingdom and Belgium in June for his first overseas trip as President. This trip will highlight his commitment to restoring our alliances, to revitalizing the transatlantic relationship, and working in close cooperation with our allies and multilateral partners to address global challenges and better secure America's interests. He will attend the G7 in Cornwall, which is happening from June 11th through the 13th. He will then travel to Brussels, Belgium, where he will participate in the NATO summit on June 14th. While in Brussels, the President will also participate in the US-EU summit. With that, kick us off.
All right, thank you. With the climate summit promised reductions in carbon emissions that the President announced this week, without the investments in the infrastructure proposal, can those be achieved? And with that, is there some red line with Republicans that you have as a result of making those goals happen?
Well, first, yes, absolutely. It can be achieved because we have several paths toward achieving that objective and that goal. Some include legislation, the American Jobs Plan, but there are additional legislative options. There's executive options that are also on the table, and of course, working with the private sector and states and localities to continuing to take additional steps forward. But I'll also say that we have every intention of getting the American Jobs Plan passed and signed into law. As we saw, and we talked about a bit yesterday, there was a Republican counter proposal yesterday. The stage we're in now is we will have discussions. We'll get a full briefing. We expect those to happen through the course of the next several days. We'll review that plan. We'll ask questions at a staff level, and then the President will invite a number of those members down here to the White House.
And if I could ask just one more.
Sure.
Is the President speaking today with President Erdogan? And with that, the Turkish foreign minister said earlier this week that if President Biden goes forward with his campaign pledge on Armenian genocide recognition, that it would harm U.S.-Turkey ties. How much is that idea weighing on the President's mind as he makes this decision whether or not to follow through on the campaign pledge, especially with the need for Turkish cooperation on things like Afghanistan and Iran?
I certainly understand your line of questioning. I know there's a great deal of interest in this particular area. I don't have any calls with foreign leaders to predict for you. As would be the case with any call, we will certainly provide a readout whenever we do a call with a foreign leader and the President of the United States, and actually down the rung below them as well. In terms of delivering on his campaign pledge, I don't have anything to preview for you on that front either. I expect we'll have more in the coming days.
Go ahead. Jen, on the Republican counteroffer, now that you've had a chance to peruse it, does the White House have any public reaction to what they're putting out there?
Only a day.
So there's an initial reaction?
As we said yesterday, Nancy, we are the President's only red line is inaction. We want to have an exchange of ideas on both sides and from both sides of the aisle. In our view, this is an example of that. We're reviewing the details of the proposal. We're starting to have conversations at the staff level today. We expect those to proceed through the course of next week. We'll ask questions, we'll exchange additional ideas, but our view, this is a good start, and we look forward to having the conversation moving forward.
But it sounds like you have a bit of a different posture on this counteroffer than you did to their counteroffer to the American Rescue Plan.
That's true, we do. The American Rescue Plan was a plan and a proposal that was meeting what we felt was a crisis situation, which was getting the pandemic under control, putting millions of Americans back to work. The president felt, as he said many times, as I said many times, there was an urgency in moving that forward, and there was less flexibility because he felt the size of that package needed to meet the moment. We are quite open to the mechanisms of how his ideas can move forward. It can be in a number of different proposals. It can be worked through negotiating between members of Democrats and Republicans. There are a lot of ideas, including the Frontiers bill that Senator Schumer has put forward, where we feel there's an opportunity to move forward in a bipartisan manner, and there's some overlap with what's been proposed in the American Jobs Plan. So we do see it as different. We do think the process will be different. There's more time to move forward. There's more time to discuss and negotiate, and we'll take advantage of that time available.
Got it. It's now been pretty widely reported that you're not going to be including a big health coverage expansion in the Families Plan, and that was going to include reducing prescription drug costs. Why did the White House decide not to include that in this plan?
Well, I will say that the president is still making final decisions, as is his prerogative, over the coming days about what will be included in the speech and the American Families Plan, and the final components of that, when those final decisions are made, will be a part of that as well. He will definitely talk in his speech about his commitment to expanding and increasing access to health care, as is evidenced by the fact that we have opened up the enrollment period for the Affordable Care Act, ensuring that more than 500,000 Americans that didn't have health insurance have it now. That's why he included subsidies in the American Rescue Plan to make it even less expensive. But I will also say, even as he's making these final decisions, that the American Families Plan and the speech on Wednesday will not represent the totality of every priority item for him and every item on his agenda that he wants to move forward as president.
And then finally, if you don't mind, India saw the biggest number of new cases in a day ever yesterday. Are there any plans to send any of the U.S. stockpile of AstraZeneca vaccine or any vaccine to India?
Well, let me first say that the United States offers our deepest sympathy to the people of India who are clearly suffering during this global pandemic, and we are working closely with Indian officials at both political and experts level to identify ways to help address the crisis. We've made vaccine cooperation a big priority, including with our Quad partners. India is one of our Quad partners, of course, in discussing vaccine creation and distribution for the future. We've also provided $4 billion to COVAX, and from the earliest stages of the pandemic, we've provided India with emergency relief supplies, medical consumables, pandemic training for Indian state and local health officials, and ventilators, which has been part of our effort over the course of time, including $1.4 billion in health assistance to India to help them prepare for pandemics in the future and deal with the current one we're facing. So there are ongoing discussions. I don't have anything more to preview, but we are in touch with them at a range of levels about how we can help them get through this period of time.
Thanks, Jen.
Sure thing. Go ahead.
Back to the infrastructure negotiations. Yep. We saw the White House respond pretty positively, or at least consider Joe Manchin's proposal to raise the corporate tax rate to 25% instead of 28%, as was the initial proposal. So should we read this conversation about raising the corporate tax rate to 39.5% as more of a starting offer?
Well, the president's proposal for the American Jobs Plan was about modernizing and making a historic investment in our infrastructure. The tax component was about how to pay for it. We're very open to a range of options, and he has some lines in the sand we've talked about, including not having the American people pay for it, or not being on the backs of the American people. It relates to the capital gains rates and the top margins that you've seen reported out there, the president's bottom line is that people making under $400,000 a year will not have their taxes go up. So if you look at these proposed numbers, which are consistent with what he talked about on the campaign trail when he was running for president, what I can say is that it will only affect people making more than $1 million a year. That's 0.3% of taxpayers, or 3 out of every 1,000 taxpayers. That's even as the top 1% saw their net worth rise by $4 trillion in the middle of a historic pandemic. So he has some bottom lines of where he will not budge fast, right, on individual numbers and who will be impacted, but he's also open to discussion.
We're hearing that White House is also considering in the proposal ending the child tax credit, even though we've seen progressives
You mean extending it?
phasing it out.
Yeah. Well,
Is that
it's
wrong?
not. It's not permanent currently.
Exactly.
So
are
you mean
guys going
extending it or
to-
making it permanent?
Is that the position, the definite position? Progressives and plenty of moderates also say that it should be extended permanently. Is that the position?
Sure. What I was trying to clarify, I apologize, is that it's not currently permanent. So the question is whether it will be permanent.
Whether that'll be a red line, like you said, or
Well,
a definite part of the proposal.
And the president absolutely feels that the child tax credit provides essential funding and help to people who need help the most. That's why in the American Rescue Plan, he increased the child tax credit from $2,000 to $3,000 per child and to $3,600 for children under the age of 6. And the expansion was the single largest policy contributor to cutting child poverty, as is evidenced by the chart we had up. We're looking into the mechanisms and the costs of expanding the child tax credit, and that certainly is under consideration for the American Families Plan.
Yeah, it doesn't sound like you guys want to budge on that one.
I think you're confusing though. It's current, and I don't mean it's not currently permanent. So we're talking about how long will be
reporting over.
extended.
Right.
And so what I'm saying is that we are quite open. We think this child tax credit is valuable. It has a huge impact on lowering poverty, reducing the level of poverty in our country. It helps women get back into the workforce. What we're determining is what we can do, and there's a cost of it. It's about $1 billion a year for every year. And so we have to figure out how to pay for it. And this is all part of the discussion.
Can I ask a question about Johnson & Johnson really fast?
Sure.
We've seen so many of the FEMA mobile clinics rely on the J&J shot, obviously because you don't have to keep it so cold and it's one shot. FEMA confirmed that only 9 of its mobile clinics were still operational during this last week with the pause. So is just how hard it is to get the Moderna and Pfizer shots in those mobile clinics part of the slowing rate of vaccinations that we're seeing?
I'm happy to check and see if that's a factor. What I understand the biggest factor is, though, is that we're now at a point where we have reached, just 2 weeks ago, only 43, it's still a significant percent of adults 2 weeks ago had received their first dose. Now it's 52%. Just 2 weeks ago, only 66 million people had been fully vaccinated. Now it's over 90 million. So we're kind of getting to this point, as I think Jeff Zients touched on this morning, where we are entering a new phase where it is more challenging. We have less of a supply issue. We have more of it's incumbent upon us to reach people and meet them where they are. So that's the bigger challenge in terms of the numbers at this point in time. In terms of the difficulty, I think you're asking about Moderna and Pfizer and how that impacts getting into mobile units.
Yeah.
The temperature.
Mobile clinics weren't really set up to be doing Moderna shots.
I'll have to check with our COVID team on how they see that as an impact. And obviously, we are continuing to adjust the way and the means at which we're getting into communities. And, we make adjustments based on what we think is the most effective. Obviously, the massive increase in pharmacies is a reflection of that. Reduction in some of the vaccination sites. We also make evaluations by where it is most impactful to invest. And some of what we've been doing lately has been increasing our investment in community health centers, in primary care physicians, obviously in pharmacies. But I will check with our team and see if that's a factor.